Good morning, all. Welcome to Doctor's Show in Midtown Clinic. Today we have here our renowned dermatologist, Dr. Priya Shankar. We're here with us. Welcome to our show.
Hello.
Today's talk is all about dermatology and pimples and acne. What is pimples? What are actually pimples?
Acne vulgaris is commonly known as pimples. Pimples is not a skin disease. It is a common condition which is seen in teenagers and early adolescents.
Ma'am, what are the causes of pimples? Why do pimples pop up on skin?
Two major causes are there for acne. One is hormonal, another is environmental. Hormonal, it is due to the increased activity of the sebaceous gland, which is the oil gland. For example, dry skin people hardly get any pimple. People with combination skin type get few pimples which is closer to the nose or on the nose, wherein the oily skin type people get lot of acne on the face. So it depends upon the oily secretion on the face. Again, environmental, it is a huge factor which is responsible in the current era. So environmental factors, it's mainly stress associated, related to work or related to education. The more the stress is, more pimples erupts out. And the food habits matters a lot. Hyperglycemic diet, for example, junk food, eating too much outside, and chocolates, ice creams have a major role. So maybe we should reduce the glycemic diet and increase the protein intake. So that is one another cause that we see.
Madam, do you say this is a teenage disease? Because I have seen a lot of people who are in their 30s, who are there in their 40s or middle ages, who have a lot of pimples on their skin. Why is that?
Nowadays we can't call pimple a teenage disease. It is commonly seen in teenage. So textbook says it's a teenage disease, but nowadays even people in 30s and 40s do have, simply because of our lifestyle modifications and changes. Nobody eats at home, people eat more often outdoor, and again, like junk foods and all that is associated, oily fried items are there, and dairy products, eating too much of chocolates and ice creams and all this. So it's an adult acne where it continues to be there in 30s and 40s. Maybe sometimes it begins in the early teenage, like by 13 or 14. It subsides by 20s, but sometime it happens only by 30s or 35 or 40. So it continues to be there till 45 or something like that.
Madam, what are the treatment options that are available for acne?
Treatment depends upon the severity of the acne. Severity means there are mild, moderate and severe acne. Mild moderate can be like treated with topical antibiotics and topical retinoids and benzoyl peroxide. Severity, when the acne is nodulocystic acne, when they have too many pimples on the face and it's all pustules and nodules, we have to give oral treatment also. Again, depending on the severity, we can divide again into medical treatment and cosmetic procedures. Medical treatment is usually given for people who just have a mild oiliness on the face and few pimples on the face. Cosmetic is mainly done to reduce the oiliness of the face. So once you reduce the oiliness of the face, automatically the bacterial activity comes down. So which means instead of giving oral antibiotics and reducing the bacterial count, you can do a peel and reduce the oiliness of the face, so the bacteria automatically dies. When it comes for medical treatment, nodulocystic acne, which is like severe nodulocystic acne, gives marks and scars on the face. Such acne can be treated only with oral treatment. To start with oral treatment, we usually give oral antibiotics. Oral antibiotic again in different ranges. For example, azithromycin or doxycycline, lamicycline, depending on the severity. First set of antibiotics can be started, and if the response is good, we can continue with antibiotic. If response is poor, set into isotretinoins. Isotretinoin depending on the age group and the gender. If it's a female, we usually give 10 to 20 mg. If it's a male, usually we start with 22, depending on their body weight again.
A lot of gens who have this pimple marks on their skin, a lot of depressions on their skin. Is it gens who get, is there any gender difference in how they get pimples?
It's not true that boys get more pimples actually. Girls also get equal amount of pimples. Only thing is that when guys get pimples, it leaves a lot of marks and scars on their face. It is simply because they meddle with the pimples, they break the pimples, it leaves marks and scars. Wherein ladies usually maintain pimple little more well. They use like cleansers and face wash, and they're always cautious about the presence of pimples. They are like little more regular with the treatments compared to guys. So once the pimples subside, it always leaves a mark or a scar. So in ladies, usually when it becomes 20s or 30s, you don't see any marks or scars. So people tend to think that males get more pimple compared to ladies.
What do you give as an advice to patients who have depressions or scars on their face?
Scars and depressions on the face cannot be treated with medical treatment. It requires cosmetic procedures. And when it comes for marks, we do lasers and peels for it. When it comes for scars, we always go for derma roller. So usually depending on the patient's requirement, if the patient wants to get rid of the marks or scars, we do procedures. Medical treatment is not effective in depressions and scars.
Ma'am, what is this chemical peeling and how is it used in pimple treatment? Is it safe?
Chemical peeling, these are basic veg and fruit acids which is used to treat the skin, mainly for pimples and pigmentation. When it comes for pimples, we use the very mild acids which is extracted from fruits to do treatment and reduce the oiliness of the face. So in case of acne, we use salicylic acid, which is the basic peel, and a black peel, which is commonly used on strong acne. We use very mild peels, like there are concentrations which is lesser, so it is gently applied on the face. It is a concentrated peels that is used. It is a controlled peeling that we call it. So it is just left for few minutes and we neutralize it. So it is not at all harmful, and salicylic acid is the mildest peel available, so it is very safe on the face. And we always advise the patients to take precautions and the post procedural causes. For example, we ask them to avoid the sun exposure on the day we do it. We ideally do it in the evening hours, and we ask them to avoid sun exposure on the next day. So this way it will help them to get more pigmented. Like photosensitivity is always associated with peel, so it will help you to avoid photosensitivity.
Doctor, there are a lot of teenagers who face this issue and they lose their confidence because of pimples. What advice do you have for all of them?
I would suggest them to stop scrubbing with heavy soaps and all that. Use gentle soaps, maybe face wash, cleanses. So that would be the basic thing that they would do it as a precaution. So ideally stop using makeup items. Do not clog the pores with too much of makeup items. Mild compact would do, so that way they can be reducing the pimple activity.
What are the do's and don'ts or advice that you have for people with pimples on
Like
this?
I mentioned earlier, most of the time if you do not do or do not touch the pimples, it doesn't leave a mark or a scar, other than the nodulocystic acne. Nodulocystic acne is an acne in which the size itself is bigger, so it automatically leaves a huge scar or a mark. Otherwise, the tiny pimples hardly leave any mark or a scar. Wherein if you sit and meddle with it, we have a condition called acne excoriae, in which due to stress, the students end up picking the scars. So that leaves a mark or a scar. Do's, I would tell, wash your face regularly. Needn't necessarily you have a face wash or a cleanser. Just if water is available at your workplace or school, just keep washing your face frequently, 4 to 5 times a day. That is what we say. So it opens up the pores, it removes the dust and the dead cells actually. So that way the oiliness is there inside also, the bacterial activity is not too much once you cleanse the face regularly. And the other do, I would say, it's more pollution associated. So when you go outdoor, use scarves and cover your face as much as possible, cover it when you're outdoor. And don'ts, I would say, like mentioned prior, do not pick the pimples, and do not use harsh soaps and rub it against and leave it a mark or a depression. So these would be don'ts that I would suggest. Sunscreen on an acne patient, I would suggest not to use anything on the face, including sunscreen. But nowadays, with the tropical country in which we live, I would suggest them to use a very mild sensitive sunscreen, which is a gel type, so that would protect the skin from the sun also, as well as take care of the skin without causing much of pimples.
Ma'am, today people are concerned about pigmentation also. Can you elaborate on what pigmentation is?
There are so many types of pigmentation. Pigmentation is a general term. For example, pigmentation that is commonly seen in early ages, 20s and all that, is usually tanning. So once the tan becomes permanent, after several years, it becomes a pigmented patch. For example, ladies usually have it on the forehead, perioral and periorbital. Perioral is again around the lips, periorbital is around the eye. So these are the common pigmentations which you will see in ladies in 20s. Tanning, when you go out regularly, you keep doing your outdoor activities, sports activities. On a daily basis, you're getting sun exposed and you're not applying a sunscreen. So there is no protection from the sun. So in that case, what happens is you're getting more and more tanned. That is, you're absorbing more and more light. The melanocytes in the cells, it absorbs more light and you're getting darker. So this on the longer run, a year or two, it becomes a pigmentation. A lady in 40s or 50s, due to hormonal activities, what happens is they get in a particular area. They get the pigmentation on the cheeks, that is melasma. So this is due to the hormonal deficit. After a particular age, once there is a deficit of a hormone, the pigmentation becomes prominent. That is melasma.
Ma'am, what can we do for this pigmentation?
At the first place, to avoid pigmentation, we should start using a regular sunscreen. Every time you are out in the sun, I would suggest you to start using a regular sunscreen. Being in a tropical country like India, I would suggest everybody, whether it is be a darker skin person or a lighter skin person, to use a sunscreen half an hour before sun exposure. If they are outdoor people like men, so most of the time construction workers, if they're totally outdoor, they do not go indoor, I would suggest them to use frequently. By noon, if they're outdoor, reapply it. People who are working indoor, apply once in the morning and they can stop after they come home.
So there are a lot of products in the market with various SPFs. So is there any specific SPF that a person has to use?
SPF, you can use any SPF from 20 to 50. Indian skin type, even 20 to 25 is actually enough. Like I told you, any sunscreen for that matter, whether it is medicated or which is commercially available, 4 hours is the duration of action. So you should reapply it after 4 hours. So when you're going out, apply it half an hour before. Say it in the morning, like 8 you apply. You have to reapply by 12 o'clock or 1 o'clock if you are outdoor.
What is the difference between pigmentation and small spots which come on the skin?
Pigmentation, when you evenly get tanned, when you have a tanning all over the face, so that is like a tan. Freckles, we call it, is your localized area where there is a melanin deposition, is freckles. So freckle usually comes in fairer skin type people. You would have commonly seen in Europeans, where they get diffuse pigmentation only on the cheeks. So that is called freckles. So where you absorb in one particular area alone, there is too much of melanin activity or too much of melanin concentration. So that particular area becomes deeper patches. So this is commonly called as lentigines or freckles. Like I told you earlier, we do peels for a lot of conditions. We do peel for pimples, we do peel for pigmentation. So pigmentation, we have a wide range of peels, starting from glycolic acid to yellow peel. So depending on the pigmentation, how bad the pigmentation is, we start a type of peel. We initially check the sensitivity of the skin and we go ahead with doing the peel. Glycolic peel, for example, once you do it on somebody, there is again a percentage. So we initially start with a milder percentage and we keep increasing with each session. And we have yellow peel, which is commonly used for pigmentation as well as pimples. So there will be patients with pimples. Post pimple, it will usually leave a mark. So yellow peel is actually a retinol peel. So it works on the pimple marks and the pimples. For such conditions, we use yellow peel, where it's a leave-on peel. We apply it and ask them to leave it on for 8 hours. So it gets a good control on the pimple as well as on the pigmentation. We have various other peels also, like lactic acid, mandelic peel and all that. These are usually party peels or function peels. Just before a function, very light and mild, gentle peels that you can do before a function or a party. So 1 or 2 days before you can do it. So after 2 days, you have a brighter, lighter look.
Ma'am, there are people who have pigmentation on the neck region, and there are even kids who have that. Why is that? Why does it come up on the neck?
Pigmentation around the neck is usually called acanthosis nigricans, So it is a condition which is commonly seen in obese patients. So when people increase or put on weight, you develop a pigmentation around the neck, in the underarm, usually on the forehead, between the thighs and all that. Commonly seen in ladies once they have a sudden weight gain or sudden weight loss. In men again you see it on the sides of the face and forehead. For acanthosis also we can do peels. Only thing is that the response is poorer. Only when you lose weight, only when there is a weight reduction, there is a difference in the improvement of the color. Peels do help to some extent, but then I would suggest, like, it is better to do side by side exercises and, like, be concentrating on the diet and all that, and continue doing peels.
Then there are friends of mine who are pregnant, currently, and they have pigmentation on their skin. Why is that? Why do the pregnant ladies get pigmentation on the skin?
The same condition that I mentioned as melasma, which is seen in people in 40s and 50s. People usually in pregnancy also, it is a variant of the same melasma. We call it as colasma. Due to the hormonal variation, similar patches they get on the face. But post delivery, the patches usually improve on itself. They do not require any treatment. It automatically improves after delivery.
Thank you, Dr. Satyapriya, for spending time with us. This was a very informative talk. Thank you for spending so much of time and giving us so much of information. Thank you.
Thank you.